This episode is brought to you by the creative husband and wife team behind Casa. The Casa brand offers design and construction services to make your house feel like a home. Check out their 2 locations in Westfield and Scotch Plains, and I guarantee Christine and John are sure to make you feel like one of their family. Visit thecasafamily.com to learn more. Well, let's kick it off, guys. Welcome back to another episode of That Westfield Podcast. Today, we're joined by the team at Flourishing Families over in Clark. We have Dr. Isla Clemente and Dr. Shelley Sousa. What's up, ladies?
Hi, thanks for having us.
Thank you.
I've been excited to have you on for a few different reasons. One, you are my wife's chiropractic care team, and she loves you, so she recommended that you come on. But also, you do something really, really unique in the space that I just definitely want to highlight and help people find out about, because as we were talking about before the show, a lot of people are struggling with more and more health issues. Kids are getting sicker, younger and younger, and there's something we can do about it, right? So
always
tell us a little bit more about Flourishing Families, how you guys met, how you got started, and then we're going to talk about a lot of stuff. This is going to be a really good episode, guys.
Well, thank you for having us. We love this community. We've been in the Cranford, Clark area for 13 years now, so we just had our 13th anniversary.
Congrats, wow.
And I joined a few years ago. I was covering Dr. Shelley for her maternity leave, and it worked so well, we decided to keep working together. But my background is I actually grew up in a chiropractic household. My dad's a chiropractor. I just grew up getting adjusted all the time. If I was sick, it was an adjustment. I didn't realize people weren't doing that regularly, and I was on no medication, no surgeries, really.
That's amazing.
Yeah, I can't complain, and I only noticed the difference when I left home. I stopped getting chiropractic care, and I was living at college, and I was playing competitive sports. I started getting sciatic pain, shooting pain down my leg. Like, what is this? And you don't eat well, you don't drink the things you should be drinking. You don't sleep as well, and you have new stress in your life. And, my body started reacting to that, and it helped me reprogram things and see. And it was a little circuitous of a journey. I actually have a master's in teaching. I thought I was going to be a teacher. And then I just kept getting this calling to own my own business, be my own boss, and then follow in this career. So I'm really happy for it. Yeah.
Wow. Yeah. I know, Dr. Shelley, you have a really cool story as to how you got into it too.
It is quite the opposite. It was actually growing up as an asthmatic child, and when they diagnosed me when I was 3, it was before it was a very common disease for kids to have, so they just put me on a nebulizer treatment 3 times a day and left me like that. When I was 16, though, I ran into a chiropractor at where I was working, and I happened to have really bad low back pain. And when I went in, she explained to me, sure, I can help your low back pain, but did you know that your nerves and your brain are under stress and they control everything else? So once the back pain was gone, I stuck around because I was curious, would it help my asthma? Would it help my allergies? Wow. And it did. So within a year, I was off a nebulizer. Within a year and a half, my allergies had cut themselves in half. So the use of medication went from daily, multiple times, to nothing.
That's amazing.
So when that impacts your life, and I already knew I wanted to be a doctor and I wanted to help people, that just totally changed my trajectory. It made me want to do something where I actually help people heal. So that's how I ended up there. So it was actually pretty fateful that I had that low back pain, or I would have never, had this experience.
Right. That is a cool story. I think a lot of people, what is it? The invention is the mother, or what is it? Necessity is the mother of all invention. And so, you just kind of go through your own journey, which helps you help other people so much better, right? When you've experienced.
We feel the empathy level of female doctors is just, you can't compare that. We both given birth. We have 2 insanely different birth stories as well.
Yep.
So just our family structures are different, and you're getting an office where you have 2 board certified doctors, knowing everything about your life and seeing you regularly and asking how you're doing. And most of our day is really educational components.
Yeah, totally.
Right. Let us do our, people want to always what are you doing? What are you looking for? It's let me be the doctor, but tell me about your day, because if you're leaving our office and sitting in Parkway traffic, to go to a job that you hate, or go to something at home that's traumatic, or whatever it is, that's going to impact your nervous system. And the last thing that happens is the adjustment. But neurons that fire together, wire together.
Hey!
Yay! So if you say, this doesn't work, I'm scared of this, this, bad, and you're beating yourself up, you're not going to feel better. And that's what chiropractic and what we really want to emphasize today for your listeners is that we are the only, again, board certified doctors and providers that are addressing the nervous system on a cellular, molecular level to change the trajectory of your life. And that's really speaking to something beyond like symptom care, you know?
Right, because people think like, oh, I hurt my back, I go to the chiropractor, oh, I had a sports injury, and people are really now just starting to understand the connection between, like I said, stress, emotions. You know, so something happens to you, like you lose your job. Like it's not just about losing your job and trying to find a new one. Like walk someone through what that can do to their physical body.
If you feel the feeling of sadness and cry, or happiness and cry, right? That is a physical manifestation. You created tears, physical tears you can see from a feeling. So tell me why stress cannot produce a physical manifestation in your body as pain.
Right.
People want a very A to B. I did this and this hurt. And like the most confused patients we see are coming in, I don't know what happened.
I love that. That's my favorite thing.
What I haven't slept in 20 years. Like maybe we could start with that, right? Like,
I like to ask people because they'll be like, oh, I don't know what I did. Well, what didn't you do? Right. Tell me in the last 2 weeks what you have not done. Right. You've probably eaten something or many things that are toxic for you. Right. Or maybe not eating the things that you need to fuel you properly. Right. Your sleep is likely not what it should be. Your stress level is a 10 out of 10 from the second your feet hit the floor in the morning till the second you go to bed at night. And so it's like a threshold. Your body can only handle so many toxic thoughts, physical, physical movements and emotional stressors before you're at the threshold where now it's tipped over and your body's asking you for help. You know, we are also, the paradigm we live in mentally and emotionally in health is like the symptom is the end all. Mm-hmm. When in reality, the symptom is like the last thing to show up, and it's when your body can't adapt anymore. It is yelling at you, like, and it starts as a whisper, which we mostly want to pop a Tylenol or an Advil because we're taught to just numb the things our body is showing us. And then it gets to the point where now it's screaming at you, and that's normally when we have people walk through the door. So yes, it can help with all of that. It's basically each adjustment lowering you below that threshold in your emotional, mental and physical stress. So that is really when people say, I don't know what I did, it's like, really? Well, you don't?
It speaks to the quick fix model we're used to, right?
It's not their fault that they don't know.
Right,
yes,
exactly.
Totally.
Exactly. We are being programmed to also beat ourselves up and identify with the pain. So every day you're telling your brain, I have back pain. So your body makes back pain.
Right. I
am back pain. And you become that. So it's really about reframing pain. And pain is a messenger just like any other symptom. So what chiropractic does is you could have too much or too little of something. Let's say thyroid. You could be hypothyroid, hyperthyroid. And if we adjust the nerves that control the thyroid, you could be hyper or hypo, and you're going to regulate, because it's about putting the system at ease.
Yeah, you're going to fix my Hashimoto's?
Yeah, well, not if any licensing's listening, but, we're putting the body at ease so that there's less to do. If you think,
This is crazy to me, though, right? Because people can heal, and healers, and I consider people like you two healers, right? In our own way, and it takes time, but the body can heal, and the fact that we can't talk about it and we can't say those things, it just, because the powers that be, it just makes me crazy.
Yes.
But people see so much relief, and that is healing, and that is beautiful, right? And so,
and it's like if the adjustment helps you sleep better, right? We're looking at things again. This is the mechanism, right? It's like a hierarchy, but if you sleep better, that's where you can start healing, right? The brain only heals during the night. The lymphatic system is circulating.
Lymphatic system, guys.
Lymphatic is circulating and cleaning up, and it's eating up all that debris throughout the night that you don't need anymore and recycling it. So if the sleep is not there, you're not going to feel better, and you might go to a chiro and be like, that didn't help me. And it's like, it's a process, not an event. I read my kids love the same book every night, I'm sure. And Grand Canyon, expert on Grand Canyon if you need a separate podcast topic. But it's a process. It's billions of years of water just trickling, and it erodes a mile down, right? There's no way you can fix stored trauma for that long in 1, 2, 3 visits, and it's not a sales tactic. It's just if you brush your teeth every day, maybe you can fit in an adjustment once a month to help your whole brain and body.
Guys, we could talk about so much. Okay, I gotta stay on track here. Okay, so obviously you guys do amazing chiropractic care, and to the level, again, down to the cellular level, where you truly understand the body, you understand the whole person, which is like super important. So you recently started offering more functional medicine modalities, including like really deep blood work. So why don't you tell people a little bit about like kind of what the blood work that they're used to getting and what you do differently?
Yeah, this is really exciting. It was actually very organic how it came to be, because we were both trained in this area in school. And then when you adjust people, you think about this toxic load, and then they go to the medical doctor for a physical. And the standard of practice is still kind of 15 years in the past, where they're only checking the superficial things that the microscope from 15 years were able to pick up. When now we have the ability to go to the subsets in each of the departments. So say, for example, cardiovascular. Most doctors are looking at your HDL, your LDL, and that's it. And then the information is based, whether they give you the medication is based on that very high level sort of information, versus now you can look at so many other subsets of cholesterol that are going to tell you what your actual cardiovascular risk is, and if it's possibly something that you can supplement, a way that you can exercise, something in your diet that you can change. So when we order blood work, we are ordering much more than the average doctor, and trying to help you change your lifestyle around that information very specifically. And really, we look at cardiovascular as like a deep dive. We do a deep dive into inflammation and blood sugar. Those are like, obviously we can order anything a person needs based on our original assessment, but those are like the holy grail when it comes to blood work. If your blood sugar is off, if your thyroid's not functioning well, if you have really dysfunctional cardiovascular testing, if we can get any and all of that under control, you just bumped your health up to a much higher level, and avoiding the need for medication or deterioration or any kind of like, health events in the future.
Right. And so I'll just use thyroid as an example, right? So like average test people get is just like their TSH, right? But if you have functional testing, you're going to get your T3, T4 reverse, your TPO, right? Your antibodies. And like antibodies are something that people don't even think about until it's like too late, right? So you have all these symptoms of hyperactive or underactive, like Hashimoto's type symptoms, and you have no idea what's wrong with you. You're tired, you're gaining weight, your hair's falling out, and it's like, why? If you had done your blood work 2 years ago and saw that your antibodies were creeping up, you would have caught that years, and then you guys can fix and adjust it.
And honestly, I believe the reason that some of this testing isn't being done in the medical world is because if there's no medication out there for it, then they don't want to know about it. Pew, pew, pew. That's exactly what it is. So why are we, like, even with blood sugar, it is probably the number one thing that we should be assessing and getting under control. And it's really not that hard, but they wait until your sugar is spilling into your blood at high levels to think it's a concern, when you could really test your insulin 5 to 10 years earlier and know already that you're resistant to it.
I keep one at home. I have one. When I don't feel well, I look at it because I'm just like, I wonder if I'm having some weird thing. And it's always high, like not high, but like I notice I'm spiking more during certain meals, and then I'm like, okay, I'm not eating enough protein. Like, maybe I do need an adjustment. Like something's off my body. And that's always like such a major indicator.
Well, and it's another aspect that women's health is different than men's health, right? Sure. Because that's called bikini science. The difference between a man and a woman is not just the type of bikini they need to wear to cover, right? There is, on a day-to-day level, a woman is fluctuating until she's beyond the menopause point. Men are steady day in and day out. No matter what, so they study. I
wonder what that's like.
Yeah. One day.
No, they only study men, right?
They
so
only study men.
So all fasting, all that stuff, it's only for men. So
specifically, like back to blood sugar with diabetic medication, they'll do the study with men and then get all the approvals they need. They hit all the criteria, release it to the public. All of a sudden, 50% of the people taking the medication are women, and they're having horrible symptoms. And now, it's in your head because nothing's showing up. Well, you're not testing what you should, and every day is a fluctuation. So get women-specific healthcare beyond the bikini science model.
That's it. That's just, you guys are spitting such truth right now, and until you've gone through it, until you've been told you're crazy 100 times, like my TSH, I ended up in the hospital as 12, and they were giving me Lexapro. They were like, you're anxious, and I was like, something's wrong with me, like help me figure it out. And then eventually my wife and I were like fighting with them to do a thyroid test, but it was so obvious, right? And most women have some sort of thyroid dysfunction, right? Just some stress, even postpartum, right? So like it can be off for like a few months, and then they put women on medication that they might not need to be on. But let's talk about, you have so many services, so let's go back because we're ranting now. So you're doing the functional blood work, and you're doing some additional 2 more things you added to Matt. And
yes. So recently, again, it's about stress. So we're trying to find other services we can offer to mitigate some of that. And it's really personal, right? Like anytime we come across something that helps us, we want to offer that. So we recently purchased what's called a Me Gun mat, which is a far infrared. It's got crystals in it, but it's far infrared heat. And when you lay on it, it helps. Of course, it feels fantastic. It helps you stay still for a little bit, which is also very helpful to the nervous system. But it can relax your nervous system and your muscles, and has a lot of really good health benefits. And then Brain Tap is actually another new service, which everybody knows that meditation is a beneficial thing for your nervous system and your body. So, but most people, when I say meditation, they immediately I can't meditate. Okay, well, we have this device now that you put on, and it's a headset that has some light input, and you can lay on the Me Gun mat and have a meditation. It's a guided meditation, but with the sound that's used and the lights that are used, it just helps your actual brain waves slow down and accept the information. It makes it a lot easier rather than thinking you have to be with your legs crossed, with your hands on your lap. So that's new to the practice, and really, again, a nice support to the adjustment and the nervous system, healing.
We feel like basically everything's about this reframing idea, right? We are so programmed of what is normal, what is not, and nothing's individual anymore, right? So you're getting a reset with a chiropractic adjustment. You can get the reset, brain tap, tap into your brain's potential, reframe things, and then have all these healing mechanisms at the same time. So you're addressing it from, a 3-legged stool, right? You can't just have the one leg of it. So that's what we really thought would be just a wellness journey for people.
I love that. And so, one thing I saw owning a health restaurant for so long was again, people are getting sicker and sicker, and I thought it was crazy. I would say these things, and people are like, "You're just nuts!" Wow, you're so negative. I'm like, no, I'm not. People are coming here because they have issues, and so you guys probably obviously see the same thing. Yeah, you're helping to heal these people and give them just guidance and make them feel better. But what are some of the biggest issues besides stress? Because everyone knows about stress, but stuff with kids. What else is going on that you're seeing?
It's interesting. It's hard to sometimes narrow down because we do take care of the way we are adjusting. We take care of infants all the way up through elderly because we're able to tailor the care to the individual. But a lot of the times we see infants, it is going to be because maybe they have some kind of oral issue and they can't feed properly, or their neck is tense, but they also have digestive issues. So it's really amazing. It's 1-to-1 when we're adjusting babies. We just see them be able to feed and sleep better, which I don't know if you have had contact with infants, but if they're eating and sleeping well, everyone is happy, And then with women specifically too, we don't ever treat anything. I just want to be very clear. Okay, we don't treat stomach issues. We don't treat fertility issues. It just so happens that when you deliver a specific adjustment based on science and the person's need, everything functions better. Right. So we see a lot of ladies who have issues with fertility or the ability to actually have a vaginal birth under chiropractic care have success in getting pregnant or delivering vaginally. The list can go on and on.
How does that make you feel?
This is why I do it.
Yeah.
I mean, and I think it's also because I feel as a woman who's been through the medical community, I just don't find that I've had many practitioners who can really fully understand what I need and kind of really connect with that so they can help me. And that's my absolute favorite thing to do. I just want everyone to feel better and, improve the quality of life. Even if you still have a little bit of back pain every now and again, what about if you can pick up your grandkids? What if you can sleep restfully through the night? It's so much about improving quality. So if I could do that even a bit for an individual, that makes me feel like $1 million.
I love that. I
love
that so much. So
seriously.
We were saying before too, every baby should be checked out, right?
100%.
Every newborn. About what age do you think is appropriate for
birth?
Yeah. On the way home from the hospital, man, just stop on over.
And I just want to say
or from the birthing center.
Yeah, exactly.
Or house.
It is not scary either, right? Like when we're adjusting a baby, everyone's like, you adjust babies? Well, yeah, it looks nothing like when I adjust an adult. I use my pinky and I hold a little bit of pressure in the right direction, and you just watch them like melt.
Yeah.
So that is really important to understand too, is that an adjustment that's delivered to an infant or a woman who's 80 or a man who's 90 is going to look completely different than somebody who's somewhere in the middle in that age.
At the end of the day, I think we're at a time in health and wellness where you just need to find people who truly understand the newer science and a little bit of the old stuff, but also like what's like the last 10 years. Like it takes 15 years for things to be delivered, and so if you're in that old modality, it's like you're just stuck and you're not getting the best care. And then of course people who I think just by sitting with you two for the last 45 minutes, like you guys just also have like an intuition, it seems, about like we could just be with somebody and like, you just feel, right? You can find, like you could really feel what they're struggling. You could feel if they're having something emotional going on, and then just like work with that, right? Versus like the person who's spending, like 5 minutes with you and doesn't give a shit. They're just like, okay, crack you, see you later. Like you guys really lock in, and that's a really beautiful thing.
Not to be chiropractic woo-woo, but when we go to some of our philosophy seminars, every person in the room knows the science and how to deliver the adjustment. And the seminars are based around understanding that we were made from 2 cells. And we are made complete, and nobody gives the mom a handbook on how to make an arm or a lung. It's all there. So chiropractic care is all about innate intelligence. It's about unlocking what's already in there. And so that is the foundation of chiropractic philosophy right there. It's the science, which we've talked about. It's the art, which is the delivery of the adjustment, and it's philosophy, which nobody out there is going to provide except for a chiropractor.
We're telling you how healthy you are, right? And everyone else wants to tell you how sick you are and what's wrong with
sister.
you.
Amen. Fun fact, I was
and what you can't do.
Major.
Wow.
You what?
I was a philosophy major, so I'm all about the
see?
philosophical thinking of things and why things are the way they are. I think that's been tremendously helpful in healing and health and wellness, because you're like, you ask questions, you're like, why? Why or why not, right? So guys, what did we miss? Anything before we wrap up here? What days are you open? Just like the logistical stuff.
We are in Clark off Westfield Ave, and we've been around 13 years. We're in the office Monday, Wednesday, Thursday, Friday, and a few Saturdays a month. So we are there till 7 p.m. since so many people are like the New York commuters, or we work around what other people's work schedules are. Your kids are always welcome in the office. We get so many questions like, I wanted to go to my OB, but they don't let kids come with me and stuff.
We
have a changing table,
toys, lollipops, stickers.
And I also just love how your office runs. Like, it's really easy. You can like make your appointment really easily. You scan in, it tells you what room to go in. It's like a little high tech. Like, it's cool. Like, it's just
we can't help you if you don't show up. Right. So we want to make it as easy as possible, remove those burdens. And the other thing that's unique is that the visit is about 10 minutes long, because we're so specific that we don't want to see you for an hour. We're not going into PT. We're not going into stretching. Like, we'll give you those tools. And we have all the people in we love our Westfield neighbors and our, all the providers that we've worked with for a number of years. They know how to do their job. So let us do the adjustment. You're in and out in 10 minutes. You have a full reset. All your love hormones, your oxytocin's flowing. You're going to get on the parkway, be waving everyone in.
I love that so much.
Go ahead. It's okay.
And
right?
don't
Everyone's
we need
reset.
that?
Yes.
Don't we need that?
So a little bit more of that in the world, and it's about ease in our office and for the adjustment itself.
I'm going to have you guys back to do like a whole nervous system
anytime.
show.
We can chisel out any topic that you want us to, because again, education it's empowerment. Right. So we really make sure that we're giving you all the information so that you can make a good choice. If we're just telling you what you need to do, it doesn't usually work.
Yeah, people need to be a part of their healing team, right? It's like you should be the quarterback. Like,
That's
you have
right.
all these people like you guys here to help you, but you still have to be like the primary and go like, okay, like what am I doing? Like, and then just be like intention minded. Like, I am going to heal. I am going to feel better. This is going to help me. And I think sometimes we just give our power away too much, and we don't kind of like bring it all together.
100%. I couldn't agree more.
Like on the same page, and that's just. I don't know how many 30 years of having health issues that you kind of figure that out at some point. But for the people just starting on their journey, it's like, guys, like, you're not crazy, right? The things you're feeling, they're very real. If you feel confused, or you feel like you're not getting help from like a regular doctor who's only spending the 7 minutes with you and doing basic blood work, go see them. Like, anybody can get an adjustment. It'll help everybody and anybody, right? So what's your Instagram?
My Flourishing Family?
Yes.
Or is it Flourishing Family Chiropractic?
Wouldn't it be good to know?
It's okay.
But I think it's my Flourishing family. But there's only one Flourishing Family Chiropractic in Clark. So
yeah, so just Google it and then you'll find them, and that's really easy. We'll put the Instagram at the bottom. We'll find it. It's okay. You're not the first ones to not know.
You know what? We're those like midway. We're like the early millennials who have the 1 foot in tech and the 1 foot out. So this can be a little challenging.
I totally get it. Don't even worry about it. All right. Thank you so much, Docs. It was amazing. This is such a good conversation, and I look forward to this episode helping hundreds, hopefully thousands of people over the next couple of years.
Thank you.
Thank you very much.
Stopping in. I think I'm going to come in. My like I said, my wife's had tremendous success with you. She was in a lot of pain, and you guys like really spun it around for her. She's like a completely different person. She's just like everything, like energy, the way she stands.
That's right.
Like, it's such a beautiful thing to watch. So I'm coming in, guys. I'm going to do it. I'm going to report back. Thank you so much, and we'll see you next time.
Bye.